Welcome everyone to this local outbreak engagement board, and particularly members of the public who may be streaming this meeting or watching subsequently on YouTube. I'm Hal Wollaston, Executive Portfolio Holder for Public Health and Wellbeing at West Berkshire Council and Chair of this board. I'll be assisted today by James Townsend as clerk for the meeting and by Kevin Griffin, who is a Zoom host. I will now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by a show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you. Do we have any apologies?
We haven't received any tonight.
And any declaration of interest from members? Minutes have been circulated. Any comments or observations on those, please? In which case I will sign them. And we'll move on to the first major item, which is the CCG update on vaccinations. And I'll ask Shira Claridge and Meredith Peachy to address this, please.
Thank you, Chair. Just to run through, so previously we updated the last meeting that the work has moved on to cohort 5 and 6 now, which is the age of 65 to 69, and then cohort 6, which is the ages of, I believe, 18 to 69. Matt and Meriden probably correct me, forgive me, and those are the patients that are deemed clinically vulnerable. So we discussed that the cohort 5 are receiving letters and can access the national system to book into the mass vaccination centres, and then cohort 6 are being contacted by their GP practice. At the last meeting, we were asked whether messaging is going out to the public around clarifying this, and I've been told that messages are included on practice websites, and information is being sent out via our normal communication routes. The mass vaccination centre in Reading is now opening, and I believe as of this weekend, 12 hours a day, 7 days a week. So they're managing to vaccinate quite a number of people. And I also understand that cohort 7 now, which is the 60 to 65 age, should be receiving letters to book onto the national system as well. Happy to take any other questions, but I believe that Meriden's going to brief about some of the inequalities aspects, and she may well correct me on the cohorts because they're probably closer to the age groups than I am. And also, Meriden, I don't know whether you're going to update on the hesitancy cohort of patients that aren't taking on vaccinations as well, but I can cover some of that element because some of that work's sort of kick-started as well.
Yes, I can pick up on some of that. I think firstly, across all of Berkshire, Oxfordshire and Buckinghamshire reached a milestone today of 500,000 people being vaccinated. And it looks like over the next, from the 8th of March, there's going to be a dramatic increase in the number of vaccines available. So it really will be full steam ahead from the 8th of March. And we know for at least 3 weeks, we're going to have a massive increase. We'll be able to have about 150,000 vaccines a week, which is more than we've had before. So, and I think the focus, as Shara said, is still on the clinically vulnerable group, group 6. At the same time, they're going to start opening up access for over 60s. And that's partly because we need to fill all the slots, and we've got a number of major, number of big mass vaccination centres open now, and we need to make sure that they're full. It's partly reliant on the national letters and partly reliant on GPs phoning and GPs sending people texts. So it's a mixture. So it should be much easier access for people. I think in terms of the inequalities, there's been a number of papers, and there is a clear inequalities gap. But I suppose we do need to remember that for the the top 4 categories, we're well over 90% of people vaccinated. So it's a pretty high percentage, actually. But the inequalities gap is going to be seen much more, I think, in the younger age groups than perhaps in the older age groups. And we've certainly seen more health and social care staff in the younger age groups not taking up the vaccine. And it seems to be Black African men, Asian, South Asian communities, and there's a Chinese community that seems to have lower uptake. But I think we knew that anyway, and so there's a huge amount of work going on, working with community activists, and West Berkshire is taking part in this like everyone else, looking at how we can contact some of those communities, and there's huge amounts of videos in different languages that people can see, and we're using the public health website. I think the council are doing some. So there's quite a lot. And I think the other thing the CCG are looking at is more mobile options for taking the vaccine out to groups, because as we get more vaccines, and the AstraZeneca in particular is very mobile, is actually using, whether it be a vehicle or other methods, or using more pharmacies. Those things are all being looked at to see if we can make it more accessible for people. So yes, I think they're the main ones, unless there's any questions on that.
Thank
No,
you,
I think
Mayor.
the only bit sorry, Meriden, the only bit I would add as well about the work was, I believe they're looking at what they call vaccine influencers to work with the communities as well.
That's right.
As part of the mobile unit. So there's vaccine influencers that can work with any communities that are hesitating to access the vaccines as well. But yeah, otherwise you covered most of the elements around the access to vaccines.
Just before I come to questions, Matt wanted to raise some on asymptomatic testing.
Yeah, I think we'll probably leave this till later on the agenda, if that's okay, Chair.
Yeah, absolutely. Okay, so we've got Councillor Bridgman, followed by Councillor Vickers.
Thanks, Chairman. Comment on the vaccination programme, and in particular, the opening of the Medeski. Firstly, I found it rather intriguing that having invited cohort 5 to the mass vaccination centres, they then sent out letters just to 64-year-olds for some reason. This was national. And then are now picking up the rest of cohort 7, so the 60 through to 63-year-olds. I wondered if there was any thought as to what on earth was going on in inviting one single year group to the mass vaccination centres. I didn't follow that. On that age group piece, there has been some criticism from, and this has also come out from some of our own PCN information, from cohort 6, to the effect that cohort 7 is being invited to the mass vaccination centres, even though they perceive as cohort 6 that they have priority over cohort 7. But of course, they are being invited, as I understand it, correct me if I'm wrong, to the PCN operated hubs, and cohort 7 are being invited to the mass vaccination centres. So that was one of the pieces I think we were very interested in getting the communication out on, the messaging out, to explain to people why they were being invited to somewhere different. I mean, I wonder whether it is, again, correct me please, is it to do with the fact that the surgeries will hold that medical record, which will inform them who is in cohort 6, whereas the rest of the cohorts is purely an age thing, and you can tell from the age profile whether someone is in cohort this, cohort that, cohort. Yeah. Now, so that's one of my points come questions. My other question, I was somewhat frustrated by the inability to advertise the fact that the Medeski was coming online prior to it happening. It was, as I described locally, the worst kept NHS secret of all time, because everybody knew that the Medeski was coming online, but as it were, public people, we couldn't communicate that and say, yep, it's coming on Monday, be ready for it. So I emailed Matt Hancock to complain about this. And as it happened, that then turned into a slight conversation with the department. Now, the message I got back from the department, and I'll read from their email, and I invite the CCG to comment. Appreciate your concerns. However, in line with the government's commitment to devolve power to communities, decisions about health and care services are essentially a local matter, and it would not be appropriate for ministers or department officials to intervene. So my question is, who put the shutters on the communications around the Medeski? Why were we not allowed to tell anyone officially that the Medeski was coming online on Monday the 22nd, even though everyone seemed to know that was what was going to happen? They're just one for the CCG.
Okay. So shall I pick up your last one first? So I don't know whether Matt and Meriden want to come into this because they're much closer in the briefings around vaccinations than I am. As far as I was aware around the mass vaccination at the Medeski was that discussions were ongoing. And I know there was a lot of logistics to work out. So I think, from my understanding, it was about not setting expectations. But Matt and Meriden may come in with more up-to-date information than I have around that. Regarding your other thing between the cohorts, why is 7 being done before 6 being completed? It's numbers, basically. The cohort 6 has got nearly double the amount of people, and you're absolutely right, Graham, you answer your own question. It's because GP practices hold that information around patients with those groups of diseases or clinically vulnerable, et cetera, So it's making the process taking a lot more time because of the number of patients, as well as the process of sort of inviting everybody through, which is why it's the cohort 5 and 7 are going through the mass vaccination centres, because it is just an age number, that needs to be collected, which is held on record. But again, Matt and Meriden might want to come in if I've missed anything there.
I think on the communication that basically the NHS are in charge of communication, and they've asked everybody not to do communication in advance of the NHS putting out when centres are opening. So I think that's just the line which we followed. And I think on the categories, the 5 and the 6, it's quite interesting. We don't know when the centre is sending out letters to people, and the centre knows how many vaccines they're sending out, but it does seem to work. The number of vaccines, the number of people getting letters are actually fairly similar. So it's not that we're getting masses of people being invited where there's no vaccine, or there's lots of vaccine and no people invited. So it does seem to match up. But it's a little bit hit and miss whether people get the invite from the GP or national letters. But a lot of people are getting a national letter as well as an invite from a GP, are getting both. But I think the thought is that it's better to use GPs' time to personally ring people in the category 6 to encourage them to go for vaccine. And they're also doing a risk assessment. They've got this tool so that category 6, they're actually risk assessing. So those most vulnerable are being done first, even in category 6.
I've got Councillor Vickers.
Thank you. Sort of similar questions in a sense, yeah, and more to do with the feedback that I've got from quite a few people in the community. I mean, my understanding, and I thought that was quite clear, that the GPs are contacting the vulnerable, and that everybody else, the sort of 60 pluses that were coming into, gets a letter. But a lot of people have been saying, well, they're hearing that you just make your own appointment, you don't wait for the letter might not come. So, and there's lots of spaces at the race course, or we're seeing that the race course is not full and people are hanging around. So why don't we just make our own appointments? There's a bit of a sort of confusion there about people, about do they wait for a letter or do they just make an appointment?
I think the message was clear. You wait to be contacted. Unless you receive a letter saying contact the national system, but otherwise the message is still very clear, as far as I'm aware, that you will be contacted. I hear there are lots of media messages that are going out and sending around these mixed messages. I've been asked similar as well. And no, there is a very nationally driven process around this, you will be contacted.
Okay, I don't see any more hands up, so if we could move on. I'm delighted to welcome Alison Parker, who's the head teacher of Thatcham Park Primary School, to come provide a verbal update, given that we have so many children going back to school next Monday. Alison, thank you for joining us.
Thank you very much. I think you probably know my name is Alison Webster from Thatcham Park Primary School. I've been here for, as head, just over 7 years, and prior to that I was a head for 9 years in another school in Newbury. So it's suffice to say, none of us have experienced this before, but we know that. I'm going to ask James, I believe. James, I prepared a short PowerPoint. I wonder if you're able to share the screen. Thank you. It's just five slides that I'll use as a prompt to talk to you all. Okay, so in my Chris Whitty moments, can we have the next slide, please? Okay, so in summary, talking to you today, I just want to say it builds on these premises. As a school, and at home, we're all really, really eager for the children to be back in the classrooms, learning together and making connections with their peers, their teachers and support staff. This can only happen in a safe way, as long as we have robust routines and procedures. That's very much our cornerstone and the cornerstone of every school. As a staff team, we were really reassured to have the implementation of the optional twice weekly LFD testing for staff that was introduced. Interestingly, and I know it sounds like you're going to talk about it later, we heard over the weekend that this is going to be extended to any household or bubble that has school children residing in it. So I'm on a big push at the moment to try and get as many parents and families involved with that. Upon the children's return next week, so I just read the message. Upon the return next week, very much our focus has to be well-being and socialisation. It's been a long time since they've all been together, so that's our priority. We also anticipate a rise in need for some safeguarding support as well. Longer term though, access to the vaccine for staff is crucial, as this will ensure no further disruption to the education. Right, moving on. Looking at elements of the journey. First and foremost, school staff teams have shown without doubt just how adaptable and flexible they can be. For this lockdown, Thatcham Park has ensured the nurseries remain fully open, all except 5 children have been in, and then we've had approximately 80 children in across the school in year group bubbles. Generally, we've had 1 teacher in each year group with the children in school, and the other has managed the remote learning for those at home. Whilst we are excited to welcome all the children back, our future journey very much relies upon everything remaining on track, which means we must all continue to follow the rules and guidance set out by the government. We must not be complacent or demon happy. While we're reassured that there's minor adjustments that we need to make in school, it's imperative that everyone follows the rules set so we can keep all of our community as safe as possible in the current circumstances. From the statistics, we know that on the 2nd of January, we had a rate of 404 in 100,000 in West Berkshire. This fell to 100 in 100,000 last week. And I believe when I looked yesterday, it's now at 90 in 100,000. And so whilst we can see that this is reducing, we're still not yet back to where we were in November, which was 50 in 100,000. So it needs vigilance all round. And that's my biggest plea to our parents, our families and community, is to stick to rules around social distancing and mixing. It's all too easy to think that if the children are in a bubble together in school, why can't they be outside of school as well? However, these choices will not support our collective efforts to overcome this virus. Part of our preparation this week is to invite some children back in across the school to attend part-time. We know that some of them will find it quite challenging to return to school. It's been a long time, and so to support a smooth transition back, some are coming part-time this week, ready for everyone to return full-time next week. Prior to this national change in educational provision, our experience has been that we've rarely had more than a couple of days' notice for the changes that we need to make. This time we were really pleased the government honoured their 2-week notice period. As anticipated, the roadmap was shared nationally last Monday, as you're aware. Another change for us was the guidance, an improvement on previous experience. The national guidance documents actually were published on the same day that we found out about the change in plans. Having trawled the guidance from a primary school perspective, it was reassuring that the only change implemented nationally was something we as a staff team had already implemented at the start of January, and that is wearing face coverings in communal areas or in areas where we can't guarantee the 2 metre plus distance. We put this in place because we had an outbreak in December, necessitating us to close the school 3 days before the end of term. So in reality, what's happened and what's been missed? When all the schools return next Monday, for us, it will be 9 school weeks plus 3 holiday weeks since the whole school were last attending in-school provision. That's just under 25% of this academic year. On top of the 14 weeks last academic year, which was just over 35% of that academic year. Another way to look at it is to date, our learners have missed full-time in-school provision for 60% of the past year if we take last March to this February, which will be 30% in the last 2 academic years. In the next 2 slides, I'll unpick some of the preparation and implications for both in school and at home. Okay, first of all, looking at risk assessment and logistics. We've stopped saying we can't do things due to the pandemic. It's a half-full mindset at Thatcham Park. We're just trying to do things in a different way. Following hearing the roadmap and receiving the guidance, we've had meetings with senior staff to revisit our risk assessment, and subsequently we've consulted with staff and governors. And today we've been communicating key information with parents. As far as implications of independent and discrete functioning bubbles, as far as for staffing, that means setting bubbles and no mixing of bubbles. So we aren't able to meet as a whole school for assemblies. We can't have more than 1 bubble together. We do, however, have 3 Berkshire assemblies each week, led by 3 leaders within the school. We can't hold whole school PTA events, and we can't have mixed age extracurricular clubs or off-site visits. We need to minimise cross-bubble working. Bubbles have to function discreetly and independently, and this has implications for additional staffing and costs. We've also had changes to the criteria for extremely clinically vulnerable people. Some of our staff are just being issued with their first shielding letter ever. This also has implications for staffing ratios and costs. We also need to consider the reopening of wraparound care, and again, we need to keep the children within bubbles to do that. So again, that's staffing and costs. As far as teaching and learning is concerned, we've tried to ensure that our remote learning and in-school provision have been closely matched. We have needed to move some units of learning around because they lend themselves better to working in larger groups with the teacher. For instance, World War II is a fantastic topic to do with Year 6, and even better if you've got them all together. Or things like maths domains that need precise teaching, so staff will need to revisit and amend medium-term planning and teaching. Teachers will be assessing learning to work out where the children are and what support might be appropriate, including considering using the government funds. However, the systems that we have to put in place mean that school is very regimented. All the children sit in rows, whether they're 5 years old or they're 11 years old. It's very much like a chalk and talk approach, which is not the way we would choose to teach. We normally have a much more flexible approach to meet the needs of interests of learners building on their prior learning. We have to have set seating plans to support contract tracing. We don't want to be in a position where we close a whole class because we don't know where the children have been. So once they have their seat, that's their seat that they have all the time. There's no sharing of resources. This limits the approaches and what and how you teach. Definitely when we had full return in September, there was a noticeable negative impact on the children's ability to work independently and for a sustained period of time. There have been no visits for the past year. We had to cancel our Year 6 residential. Swimming lessons didn't take place. Upton Court residential didn't take place. We always take the children to the pantomime. We didn't do that. There's been so many things missed, but we're trying to find alternative ways of getting the joy back into school and learning. We've got implications for staff. Our teachers in their discrete bubbles and our teaching assistants have a captive audience of 30 beings breathing aerosols on them all day. It cannot be compared with being in a supermarket where customers are moving through. We also have an increased cleaning regime and hand washing. I'm not sure if you thought about the implications for lost learning. time. A class of 30 needs to wash their hands 6 times a day on top of when they need to use the toilet. That's a lot of time that gets denoted to that. We also have a robust cleaning regime of resources and high contact surfaces, including outdoor equipment. As far as break and lunchtime is concerned, we have to have allocated play spaces for bubbles. We also have to allocate toilet cubicles. We have to allocate times for playtimes, time for lunchtime to spread the children out, which means staggered breaks and lunch for all pupils and staff. All children in year 1 to 6 are eating their dinner in the classroom, whether they're having hot dinner or packed lunches. We can't have everyone in the hall together. I have to tell you, the carpets have taken quite a hit. Ventilation. Obviously, we've had very fluctuating temperature. When we first started the lockdown last March, April, I'm sure you all remember, we had beautiful weather. And now take yourself back 2 weeks where we had freezing weather. The building has to be ventilated according to the weather. Windows do not have to be kept fully open, but some, if not all, need to be open a bit to allow air in. During the colder weather, teachers have been able to keep the external doors shut during lessons, but they have to be open throughout breaks and lunch to allow the air to change. We have to balance thermal comfort with the need to have fresh air circulation. For instance, if it's blowing a gale outside, the windows only need to be open a little to get the airflow in, but on still days, the windows may need to be open more. In short, where the rooms where children undertake their learning, where there is restricted movement, can be rather chilly. One of our staff suffered with terrible chilblains on her fingertips in the recent cold snap. There have been times when staff and children have been wearing extra layers, coats, hats and scarves inside the building doing their learning, not to mention the cost of running the heating with the doors and windows open. Uniform. We shared with parents that up until Easter, at least, the children should wear a hybrid uniform, that is their school jumper and their top, but they should be wearing dark joggers or leggings with their trainers. This is due to the cooler temperatures and the focus on outdoor learning as much as possible. The joggers are much warmer, the physical activity needing robust footwear, not to mention that I'm assuming that a lot of children may have grown out of their shoes and their uniform, and I happen to know that these are not essential shops that will be open, so even if they have grown out of them, they won't be able to replace them. And finally, the risk to staff. The constant message we hear is that schools are safe for children. Let us not forget that on a daily basis, staff are sacrificing and risking their own families, especially where they may have dependent or older family members for whom they are principal carers. We also need to restrict our adults that gather on the site. We've been very lucky today to secure a banner from the local council that will encourage parents to follow the rules. We operate 3 one-way drop-off pickup routes. We are also making sure that it's a kiss and drop for all Key Stage 1 and Key Stage 2 children so that we don't have lots of adults on site at the start of the day. Senior staff will need to supervise gates to monitor and support. All adults on site are asked to wear a face covering. All contact with staff is done through telephone and email. As far as staff and governors are concerned, there's no hot desking and no office showing where desks are less than 2 metres apart. There's been an increased number of staff breakout spaces, but only 4 people can sit for lunch due to social distancing. We have 54 staff in total. It's very isolating and it's very fragmented, and it's especially worse for those who live alone. All movement around the building is external as much as possible. Masks are to be worn in communal areas or where 2 metre plus cannot be managed. Staff only access the area they work, i.e. there's no visiting somebody else's workspace for a quick catch-up. We've invested in webcams for all of the PCs, so all staff meetings now take place virtually. So in effect, at the end of the day, we have teachers sitting in their class on their own, talking to a screen, a bit like we are today. All governor meetings are also virtual. As far as contractors and visitors are concerned, essential visits and visitors only, contact is by email or telephone. Everyone's asked that face-to-face meetings are by appointment only, and where they take place, then social distancing must be maintained, and we have to have the face coverings. Use of outdoor space areas are used for meetings as far as practicable as well. Moving on to slide 4, please. So, the final bit is about supporting parents to prepare. Let's not underestimate, these children are totally out of routine. Well, many of them are. So we've encouraged our parents to start talking to their child about how they're feeling about going back to school, Ask them if they're worried or scared about anything, but also what they're excited about and looking forward to reassure their child that it's completely normal to feel a range of emotions and that everyone will be in the same position. We also want them to reassure their child. During the lockdown, we've been told to stay at home, remain socially distanced from others and wash our hands regularly. This means children may find it difficult to go back to school because it's a huge change from what they've been asked to do since the last time they were in school, some 12 weeks ago. Talk to their child about the ways that they can keep themselves safe in school, like hand washing and not sharing equipment. Reassure them that school still has in place lots of measures to keep them safe. We also ask our parents to re-establish a routine to help ease into school life. During lockdown, it's understandable that their family's routine may have changed. Children are likely to have been waking up later and going to bed later. To help them get ready for school, try to get back into their usual morning and bedtime routines. We also know that some of our savvy children will have worked out if they get up early and do their work early, they've probably finished by lunchtime and they've been having the afternoons to themselves. So it will also be a shock to come back to school and be learning all day. The transition back into full-time learning in school is likely to take some time. Lots of children will experience ups and downs and may find the return to school extremely tiring. Thinking ahead, as well as reflecting on what has happened over the last half term, it's also important to help children develop hope and a sense of excitement for the future. It can be hard to feel positive, but identifying the things that they can look forward to will help them to realise that the current situation won't last forever and their feelings will change. Finally, we encourage all of our parents to seek support if they need it. Transitioning back to school after being in lockdown is not easy. They may find that their children struggle with the routines and expectations of the school day. As a staff, we encourage our parents to please make contact with their child's teacher via the office if this is the case. And that's just a short snapshot of where we are. If you like my risk assessment, I'll happily send it.
Thank you, Alison. I'm sure a lot of parents will be reassured about the amount of preparation you're putting into this. I've got questions from Councillor Doherty, followed by Councillor Berg initially.
Thanks, Alison, and thank you for the presentation. Very insightful, and please thank all of your staff because it's actually really interesting to hear the day-to-day details. I think we all talk about schools going back, but hearing the challenges you face firsthand really gives you an insight into that. A couple of questions from me. Have you found, obviously you've got a range of ages of children, and it was interesting to hear you talk about trying to get children to sit in rows and set seating plans, etc. Do you feel that there's been one particular year group that has been more adversely affected than others? Have you, or has everybody, I'm interested in how the children are coping with this, I suppose is where I'm going at. So we've heard about the routines and everything, but how are children actually responding to it? And do you feel that there's, is it our sort of, nursery provision, our infants that are more affected than our juniors? Are they more used to following the rules? Have you sort of got an insight into how the children are coping with this?
I think what's important to remember is as far as our nursery and reception are concerned, life is pretty much normal. We've just tried to make sure they have more space. So where our nursery room is quite small, we've given them another room so they can spread out more. But obviously as the weather gets better, the more they're outside, the better, and we have that free flow of learning. Because we introduced the seated in rows back in September, so children as they left foundation moved into year one. Sadly, they don't actually know any different. They think that's what year one is. And we look forward to the time when we'll be able to share with them that actually that's not the way we normally work. The difficulty is what it stops you doing as a teacher is responding in the moment. So for instance, if you are teaching within the class, but you notice there's a group of children that haven't quite got it, you could say, right, let's do some peel away. You come and join me on the carpet. We'll carry on. The rest of you can get on now with your independent work. You can't do that. You can't pull those children together in a group on the carpet because you can't have that sort of masked little gathering going on, and then that puts the adult at risk as well. So that's been the limitations of it. And things like having lots of volunteers in to come and help them do the reading and things like that, we had to say no. So that's where we are losing out a bit, or rather the children are losing out, but we'll find a way, we will, moving forward. The older children, it's easier to say you must stay in your seat, you mustn't get up, you mustn't walk around the room. The younger ones obviously find that a little bit more difficult.
Okay, thanks, Alison.
Thank you, Lynn.
Councillor Berg.
Thank you, Chairman. Thank you, Alison. It's really insightful talk you've given us. I'd echo Lynn's thanks to you and your team. Could you tell us a bit about the process you're going to go through to assess where the children's learning is now when they're back at school? And could you tell us what you're most looking forward to when they come back?
Okay, so let's do the assessment one first, Dominic. So first of all, you know, our teachers assess all the time anyway. Assessment for learning is a tool that they use all the time. But what's really important is that we don't make the children feel like they're constantly being tested. So there'll be a whole range of observations and little quizzes and things like that to try and work out where they are in their learning. The great thing is, for those children that have the support of their parents and have been engaging in the remote learning, they've been submitting their work online to the teachers. So the teachers have been able to be doing this online feedback to them and have a view about where they are. What we don't fully know is how much their work has been independent at home, or whether they've got used to having effectively a PA with them all day, which is lovely, but it makes them quite dependent on an adult, which we don't have here all day, clearly. So that there'll be gaps in all areas. But, you know, teachers are teachers, and they've always done this. And we've always had a class full of children that are a wide range of abilities, and differentiation is the way forward and always has been. A child will have what a child needs. As far as what are we most looking forward to, it'll be on that gate with those big smiles on Monday morning. But I have to tell you, the remote learning package that we've operated here is the children who have been learning from home have mostly come into school over a period of 5 hours every Monday morning to pick up a big work pack. So they've had the opportunity to meet with a teacher within their year group and have a little chat as well, make those connections. But we've also had Zooms going on as well that the majority of the children have taken part in. What was interesting was for those children who weren't coming into school, some of them didn't appreciate that some children were in school. And when they started to come in on the Monday, I think they felt like, well, what do I have to do to be able to get into school? Because that's where I want to be. So I do think the children have missed us as much as we've missed them. And I can't begin to tell you, my staff just want them all back. And let's carry on as we should do. Okay, thank you.
Thank you so much.
Councillor Masters.
Thank you, Chairman. Thank you, Alison. A really comprehensive overview of what you and your staff have been doing to ensure the safety of the children and obviously the safety of the staff and to foster a really good learning environment. Just so I can get an idea, how many of your children have been in as key workers either at yours or other schools throughout the period? Is it quite a modest number, or has there been quite a few?
We've had in total just over 100 children in, but that includes a nursery which remained fully open. I would say it's about 25%, and that seems to be typical amongst my colleagues, about 25%.
Do you have any, a further question if you don't mind? Obviously, staff who are underlying health issues and everything else are hopefully going to get vaccinated fairly soon. Are you lobbying to try and get the rest of your staff vaccinated as soon as possible?
I think you could speak to my staff. They're all waiting for their call and their letter, as soon as we can. But I don't think I can support jumping the queue, given that if we jump the queue, that means there's a more vulnerable group that would go without. And I'm not so sure that sits comfortably for myself personally. I'll wait my turn. It will come.
Thanks very much, Alison. Good luck on Monday.
Thank you.
Finally, I have Councillor Vickers.
Thank you very much, Alison. Yes, I must say I was feeling a bit overwhelmed listening to your presentation, thinking of it's a pretty tough job you have anyway, but now you seem to have 100% more to do and think about. It just seems to be tremendous pressure, and good luck, when everybody's back. I'm just wondering about yourself and your staff and the support to you and how you're coping with that. Do you Do you have a network of other heads, or you said you had Zoom chats possibly with staff? So how you're supporting yourselves with all this extra pressure that you've got, and what you think maybe the council could do to help you, or maybe that's all already being thought about. You said you can't, I mean, obviously the children are going to come back and there's going to be extra problems there and extra need to support them with emotional issues and things like that, which you always have, but you're going to have more of, and maybe even problems with parents who are normally used to talking to you. You said you can't use volunteers. Is that the case? Because that's just not possible.
The reason we've not been using volunteers is because we're trying to minimise the number of visitors to the school and the number of people that are going from one community to another. So we have minimised that. You've got so many questions there, Martha, that I want to answer. That's okay. So first and foremost, I want to reassure you that there is support out there for everyone. Okay. We all have access to a support line that was set up by West Berkshire. Teachers can call in anonymously or otherwise. We have fantastic support from the Educational Psychology Service, who are there to support wellbeing of all staff. But what I have to tell you is that West Berkshire Education and all the affiliated parties with them have done a fantastic job in supporting us as head teachers. I personally have been involved in fortnightly, well, it was originally weekly, keeping in touch, telephone calls as a member of the executive primary heads group as a representative head, which we're able to do. But I think the beauty of working in West Berkshire is that we all know that if we need help, we can pick up the phone and there is someone there to support us.
Good.
Alongside that, obviously, I have the support of my governors as well. Although we've not been able to meet in person, that doesn't stop us doing things virtually. And I meet with my chair of governors every week as well, on the telephone. You know, just because we can't be in the same room doesn't mean to say we can't continue the relationship that we have. Colleague heads, fantastic. We have a very active West Berkshire Primary Heads Association, and sort of attached to that is a very busy WhatsApp group. That's all I'll say. And that's great for support and ideas, and people have seen things. You know, we learned about the LFD testing over the weekend because someone saw it and then they shared it straight away on that WhatsApp group. So, and then let's not forget my own staff. You know, I'm not an island. I'm not on my own. And it's the staff that make the school a great place to be, and you know, just understanding each other and just being aware and being in touch with each other about how everyone's feeling. You know, they talk about we're all in the same boat, but we're not in the same boat. We're all in different boats in the same storm, and that would be the same for my staff as well.
Thank you very much. Thank you.
Alison, thank you so much for sparing the time. You're clearly an inspirational head teacher, and I think your staff and pupils are very lucky to have you. And thank you for sharing the information tonight. Okay. If we could move on perhaps to the situational report from Matt Pearce.
Evening, everybody. So just going to take you through the data as things stand at this moment in time. So just a brief reminder that since the last Local Outbreak Engagement Board met, we've since had the publication of the roadmap out of lockdown by the government. So I'm not going to go through that in any detail here. The key things really are from the 8th of March. We know that pupils and students, as we were just talking about, in all schools and further education will be returning to face-to-face education. Outdoor recreation, such as picnic, is allowed, and this can be on your own with one other person or with household and support bubble. Indoor visits to care homes can start again for a single name visitor, and wraparound childcare can reopen and can restart for children where it's needed. So as I said, lots of that information is available on the website, so do check that out. And I'm sure Mandip will cover later on in terms of what the council will do in informing the public as we go through these different phases of the roadmap. I think it's important to note that they are separating these changes by 5 weeks. So the government are really keen to look at and monitor the impact of these lifting of these restrictions on the infection rates, and that's really important because obviously it's really important to keep those infection rates as low as possible. In terms of where we are with the local rates, you will all be familiar with this slide by now. So we've had just over 6,000 cases in West Berkshire since the start of the pandemic, and we've had 113 in the last week. When this slide was put together, which was today, our rate was at 71.3, but I understand it's now at 63.7. So it's coming down quite quickly now. And the positivity rate has dropped at 3.7. So you can just see West Berkshire highlighted here. As I said, our positivity rate's at 3.7. That's quite a big decline. It was at 5% only a couple of days ago. And then the other really good news is the cases per 100,000 for 60 over is below 50, which is really good news. And there is some indication nationally that the vaccinations might be start having a positive impact on both transmission and death rates. In terms of the epidemiology of the cases, so I thought I'd just highlight the actual epi curve. I think there have been some questions to date. So on this one, we've got the date on the bottom and the rate per 100,000 on the left-hand side. The blue line is West Berkshire, the red is the southeast, and England is the green line. And I think there were some questions previously about that the rate of decline in West Berkshire was looked to be a little bit slower than the regional national average. I think that's partly down to the fact that we were starting from a lower position with our rates per 100,000. But like similar areas, we've experienced quite a number of outbreaks as well, and that does keep the rates high. But as you can see at the bottom now, we're generally the same as the southeast average, but we're lower than the national average. So certainly all going in the right direction as things stand. I just wanted to share this slide really. It's just the case rate of COVID-19 per 100,000 in the most recent 7 days. So on the left-hand side, this is actually a map of Berkshire. So I highlighted West Berkshire here. So again, our rate is between 0 and 100 per 100,000. We have Slough, which is the only local authority within Berkshire with the rates higher than 100 per 100,000. And then to the right-hand side, it just shows you the rates change by different colours. So again, ourselves and Reading have seen a rate change of between -21 to -40. Wokingham between 1 to 99, actually it's a slight increase. And again, you can just see the variations between the local authorities in terms of the speed of the decline or slight increase at the moment. So again, the rates per age group, we tend to use different heat maps. So if you'll recall, this just tells you the rate per 100,000 depending on the different age categories. So the age ranges on the left-hand side. And then we have the weekly dates on the bottom here. So as you can see, across most of all the age groups, the rate per 100,000 is slowly decreasing. The highest rate is in 18 to 24. And 25 to 59. I did do a little bit more of analysis on the 25 to 59, and it's the 30 to 34 age group where it's slightly higher than the other age ranges. But as I said, they're all coming down, which is certainly positive news as things stand. I just thought I'd talk a little bit more about common exposures, and I don't think you would have seen this before. So what this graph is showing is the exposure events reported by cases in West Berkshire in the 7 to 2 days before symptom onset. So what I mean by that is every time somebody tests positive, NHS Test and Trace will make contact with them and try to understand where they've been in the 7 preceding days. And that will give us an indication in terms of where they might have actually caught the virus. And then what we do is we also look at other cases and ask them the same question. And that can give us an idea about whether there's commonality in terms of where there might have been transmission. And that's what we use then to explore what settings we might need to investigate that comes up on an exposure report. So really what this is telling us, and it's just for really information about what we do to manage our outbreaks. We have the different various settings on the left-hand side here. We have the weekly rates on the bottom, the dates, weekly dates. And then the larger circles represent the number of exposures, and then inside is the proportion. So you can see workplaces have been identified as common exposures, and it's common sense to assume that a lot of people have been at work. So that could be an obvious reason why that might be the case, but nevertheless, that does give us some indication that that is a likely route to transmission for some people Equally, retail and shopping has been relatively high throughout the pandemic. So you can see some fairly large circles and percentage of cases. But again, these circles are reducing in sizes, as you can imagine, which corresponds with the rates. Equally, healthcare is another area. And we know that obviously that there can be infection issues in terms of infection control in hospitals, and then some education 16 plus. So it's just to really give you a sense in terms of what we look at in terms of outbreak management and try and identify common exposure points, and as I say, investigate where required. In terms of the electoral wards, I think we just need to be a little bit more mindful now as our rates are going down quite significantly. We are starting to see small numbers within our ward rates. So we just need to be mindful in terms of that any small number can fluctuate quite significantly if we have one particular outbreak in a setting. So as again, they're all going down. Previously, I had quite a few outbreaks in the Newbury area, which is a number of reasons why those rates were particularly high. But over the last week or two, we've not seen any big outbreaks, which again is really positive news. In terms of the death rates, so again, you'll be familiar with this. And unfortunately, there have been 224 related deaths during the pandemic. 120 of these were in hospital, 88 were in a care home. And in the last week, sadly, 5 people died from COVID related. In terms of the overall mortality rates, it's slightly lower than I think a couple of weeks ago, where it was 20%. So we're 19% higher than the previous 5-year average, which equates to around 219 additional deaths. So I'm not going to go over the summary. I think I'm going to move straight to testing. The one thing I will just point out, which I think is probably important that the public might want to be aware, is that we're currently not aware of any variants of concern within West Berkshire. And obviously, if we do we have a plan now in place. Should that be the case, we can respond effectively and test the required number of people. And just to point out from what Shira was saying, the latest data we had on vaccinations was just shy of 40,000 individuals have been vaccinated. And that data is publicly available now on the Office for National Statistics and how many vaccinations have been taken within the specific cohorts. If it's okay, Chair, I'll just quickly move on to testing, just conscious of time. Just a quick one, because it is moving quite fast in terms of testing provision, and where things are at the moment is as we've just heard, schools need to provide a level of testing from the 8th of March. 3 tests need to be taken on site for secondary age school children. And the 4th test that they do can be undertaken at home, and they'll be required to take it at home for the foreseeable future twice weekly. And we know that testing will also open up to their households and their childcare bubble and support bubble. What we're starting to hear with our schools in West Berkshire is we recognise this is quite a big logistical exercise, and that many of them are actually starting to test pupils now in anticipation of that 8th of March start date. But even from the 8th of March, they can stagger their return as required, recognising this might take some time. As with all home testing, what we know from the government is even if somebody tests positive and they've taken the test at home, they will need a confirmatory PCR test. So that would likely have to take place at Newbury Showground or request a test online. And the reason for that is we know that when people test supervised, they're more likely to get a higher quality testing, but at home it might not be as good because they're not being supervised. So that's why they get a confirmed PCR. We're still understanding our role as a local authority to provide support with the home kit distribution. So we're just waiting for more information from the government to help with that. So I think really there was a big expansion today. As I said, there's still a focus on citizens who need to leave home to work. That's the ones we really want to test. Large organisations are very much, particularly businesses, encouraged to set up their own testing on site, and they can register to do so at the gov.uk. In the long term, what we know is there's going to be these new click and collect options for people to collect their testing kits, and that's what we're just working through what that might look like. And people can go online and then pick up test kits, which I think are about 28 kits per test. the 28 tests per kit. And availability of the home testing kits will be carefully managed to ensure continuity of supply. So again, we're just waiting for the Department of Health and Social Care to do that. So the main channels, as I said, institutional testing. The big employers, we're hoping they can set themselves up with their own testing stations. The medium-sized institutions between 50 and 250 employees, they can access testing again through their own workplace sites. However, they can also utilise the community testing sites we've set up here in West Berkshire, which I know is discussed at the last local outbreak engagement board. And then those small organisations with 50 less staff, then they can certainly use our community testing sites for them. As I said, online ordering of home tests, we're hoping to be launched soon. And then the other option will be the collection from community test centres, which again, we'll communicate with the public as soon as we have more information about how that will happen. So just finally, just to conclude, the useful links are people can still go and book for asymptomatic testing. I just want to make that point. This is for asymptomatic. If you do have symptoms, it's really important to book through the national system, whether that's Newbury Showground or whether online ordering. But this is for those that don't have symptoms. Businesses wishing to set up their own testing sites can again visit the gov.uk website. And then LFT kits are available also from that website and for household childcare bubble. I don't believe that's quite live yet, so we just keep our eye on that. And again, we'll communicate with the public once that's available. I'll stop there.
I've got a question from Councillor Bridgman.
Well, not so much a question, Chairman, but I think for those watching who are interested in care home visiting, just to say that we're still waiting for fresh guidance. We know the announcement about the changes from the 8th onwards with a single tested visitor able to touch hands with care home resident in the right circumstances. We haven't republished the guidance yet because we're still waiting for the full guidance from government. As soon as we get it, we'll republish.
Thank you. Can we just move on to communications? And we are running a bit short time. I would like to wrap this up by saying if we could. So, Amanda, if you could be brief, I'd be grateful.
Okay, I will rattle through it then. So our main focus, obviously, at the moment is about the roadmap from the announcement last week. We made sure that information that was given at the 3 p.m. briefing was out within an hour on our social media. That was a team effort to make sure that we got that out as soon as possible. And then we also sent out a special newsletter the next day with all of the information on there as well. And our focus going forward is really going to be on kind of step 1 and the 2 stages under step 1, just so that it's not overly confusing. So that's what we're working on at the moment. We've also been working with the schools to create banners to encourage social distancing at the school gates. And Alison mentioned earlier that she's received one, so that's good. So the uptake's been really good on that, and we're just going to keep working with the schools to make sure we can get some more sent out. We've been working with Public Health Berkshire to put up the videos about, following the kind of lockdown rules. And these are fronted by key members of the community, so they have a much more better impact that people can kind of recognise these people, and they've all been positively received by the public. As Matt mentioned about lateral flow tests, we've been doing some comms around that for the LFTs for the key and critical workers. We've put together a video, which is a step-by-step kind of guide to show how you book a test and what happens when you're actually at the centre as well. We've also been talking about the 2 new sites that are up at Hungerford and Burfield, and also encouraging businesses who qualify to sign up for the lateral flow test as well. We've been doing some bits on COVID marshals, again, they continue to provide an important resource in our kind of compliance for dealing with COVID. We've put together a video as well about them and their role out in the community, and that's gone down quite well. We've also put out some stuff on a grant that's available for early years education providers, and that's to kind of give them some financial support to help with the challenges of the pandemic. And also we've got some extra funding available for rough sleepers, again, during the pandemic, to kind of continue to provide them with accommodation under the government's Protect programme. And then lastly, Lynn and Matt are doing a Facebook Live on Thursday So this will be to provide an update on our ongoing response to COVID and also answer any questions that residents and businesses may have. So if anybody does have a question they want to put forward, I would encourage the public to email pr@westberks.gov.uk before Thursday, and then we can put that question forward and get that answered. And that is my quick run through of my comms update.
Thank you, Mandip. You're lucky there's no questions. So I just remind you, we'd like any agenda items at the next meeting. Matt has suggested perhaps looking at vaccine hesitancy. Any other business, anybody? I can't see any. So I think the meeting has, our business has been concluded. Would all panelists please remain in the virtual meeting until the host has confirmed the meeting is no longer being streamed. Thank you, everyone, for attending the meeting, particularly the